One. Please start, sir. We are live.
Good evening, everyone. On behalf of NASH 24 into 7, I welcome you to our public awareness program on consequences, diagnosis, and management of NASH. NASH 24 into 7 aspires to bring best in class education and awareness program to serve healthcare workers, patients, and their caregivers. To speak on the topic today, we have a renowned gastroenterologist, Dr. Rohit Mehtani from Faridabad. He needs no introduction. However, I would fail my duty if I don't mention that he is a leading gastroenterologist from Faridabad, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has over a decade of experience building a clinical skill set that allows him to deliver patient-centric care. He is assistant professor DM Hepatology at Amrita Hospital, Faridabad. We salute, sir, your dedication towards spreading awareness related to liver health and diseases. So now I invite Dr. Rohit to enlighten us on consequences, diagnosis, and management of NASH. Over to you, sir.
Thank you, Raj, for the kind introduction. I am privileged to be here today among all of you to share my knowledge on the very common liver problem, that is fatty liver. I bring greetings from Amrita Hospital, Faridabad. So I am practicing as an assistant professor in the Department of Hepatology at Amrita Hospital, Faridabad. And I'll be focusing my talk on the consequences, diagnosis, and management of NASH. NASH means non-alcoholic steatohepatitis. It is a subset of fatty liver disease, which is a more severe form and which requires treatment and management. So just I'll be talking brief overview of the liver. That liver is a second largest organ of the human body after the skin, and it weighs around 1500 grams. It lies in the right upper part of the abdomen, and it is brownish in color and has a soft consistency. It is a highly vascular organ, and it is unique in the sense that liver is the organ that has a dual blood supply in the body. So the liver receives blood from the artery, which brings oxygenated blood from the heart, and the portal vein, so which brings absorbed nutrients from the intestine. So whatever we eat, whatever medicines we take, all of that is absorbed and goes to the liver for detoxification, for absorption of nutrients, for metabolism, and for energy production. So liver is one of the most important organs, and because of its functionality, till now medical science has not been able to develop a artificial liver support system that can mimic all the functions of the liver. Like we have dialysis for a kidney, which can effectively take care of the failing kidneys, but for liver, because of its vast more than 500 metabolic functions, we don't have a separate system artificially which can take care and which can perform all the functions of the liver when there is liver failure. So it is very important that you take care of your liver from the starting and prevent liver failure from happening. So coming to functions of the liver, as I mentioned, there are more than 500 functions which the liver performs. It metabolizes and breaks down nutrients from whatever we eat and produces energy. It removes the toxic byproducts of the medications which we take. It also stores vitamins, minerals, and sugar in the form of glycogen and fat in the liver. And it is a protein producing organ, and all the proteins which are not met by diet are produced from the liver, most important of which is albumin. It produces bile, which is secreted into the intestine and is involved in absorption of fats and fat soluble vitamins like vitamin A, D, E, and K. So if the liver is not functioning properly, we have deficiency of fat soluble vitamins. There is low protein in the body. The nutrients and the energy stores of the body go down. We are not able to metabolize the medications which we take, and there is increased risk of drug-induced liver injury. So medications can harm the liver and the body. And it is also an immune organ, meaning that whatever infection-producing bacteria are coming from the bloodstream or from the intestines. So the liver is plays a very important role in killing those bacteria. So if the liver is not functioning properly, there is a very high risk of getting infections. And it also regulates the blood clotting. So patients with liver disease, often we see they have bleeding tendencies, they have bleeding into the skin, they can have bleeding from in vomiting, bleeding blood in the stools. So it is also an important organ which regulates the blood clotting factors. Coming to burden of liver disease in India, recently the Ministry of Health and Family Welfare has incorporated liver disease, that is non-alcoholic fatty liver disease, into the non-communicable disease program of India. And this was a very welcome step from the government, which has, it is the first liver disease to be incorporated into the non-communicable disease program. And because of this, the awareness and the funding and research for liver disease is increasing day by day, so that we can provide comprehensive care and better care to the patients. So globally, it accounts for about 18% of the deaths, liver disease. And despite advances in medical sciences, the number of deaths from cirrhosis and liver cancer are increasing day by day. And in India, most common causes of chronic liver disease or cirrhosis are non-alcoholic fatty liver disease and alcohol-related liver disease. However, hepatitis B and hepatitis C remain a major cause of chronic liver disease and liver cancer. Now, so today we are going to talk about fatty liver disease. So it is a spectrum. It is not that a patient with fatty liver will remain at fatty liver stage and will not progress. So liver disease starts from an acute hepatitis or chronic hepatitis. The causes of acute hepatitis and chronic hepatitis are more or less different. Acute hepatitis is more commonly due to alcohol, viral hepatitis, and drugs. However, chronic hepatitis can be due to non-alcoholic fatty liver, which is becoming the most common cause now, alcoholic liver disease, hepatitis B, hepatitis C, and autoimmune hepatitis. And this chronic hepatitis, once it happens, it has a tendency to progress towards cirrhosis. Cirrhosis means end-stage liver damage. So the liver has completely been replaced by scar tissue, and the functioning of the liver has decreased. So it can be a stage of compensated cirrhosis where the liver function tests are normal, the patient does not have any jaundice, the bilirubin is normal, there is no other decompensation. Or it can progress to a decompensated state, which means that he has varices. This is the picture of the food pipe, which is showing prominent veins. These usually bleed in liver diseases and cause blood and vomiting. Or the patient can have fluid in the abdomen, which requires repeated removal by a needle. Or he can become unconscious, the brain go into a stage of coma that is known as hepatic encephalopathy. Or in the last, he can develop a liver cancer. This is the most severe form of decompensation and usually the end result of long-standing cirrhosis. Now, fatty liver is an emerging epidemic in our country. So the evolution of mankind has seen a drastic change with the increase in sedentary lifestyle, use of mobile phones, laptops, computers. People are glued to the television screen. They are taking all sort of soft drinks, colas, the westernization of the Indian diet. This has all led to an increase in obesity, diabetes, hypertension, and fatty liver. So what is fatty liver disease? This is a representative photo of a normal healthy liver. It is brown, pinkish brown in color, soft consistency. Fatty liver occurs when more than 5% of the liver cells are have fat in them. So it becomes visibly, the liver becomes yellowish in color. It becomes more soft. It has a lot of fat in it. And if it is untreated, it can progress to into NASH. That is, along with the development of fat, the fat is causing injury to the liver. It is causing scarring of the liver. So patients who are overweight, obesity, or diabetes, or have a high lipid profile or high cholesterol level, they have an increased risk of developing of NASH. So in general, overall, when we see almost 25 to 30% patients, that is 1 out of 4 people will have fatty liver disease. There are some studies which have shown that even up to 50% of the normal population in India has fatty liver disease. And when we talk about patients with diabetes, almost 6 out of 10 will have fatty liver. And obesity, that is a BMI of more than 35, severe obesity. Almost 9 out of 10, that means 90% of them will have fatty liver disease. So coming on to the burden of fatty liver, as I told that it is a spectrum. So healthy liver is when there is less than 5% fat in the liver cells. It can become fatty, that is non-alcoholic fatty liver disease. So in this stage, there is only fat in the liver and it is not causing any other problem to the liver. Just the on biopsy or if we do an ultrasound, we get fatty liver disease. And that means that more than 5% of the liver cells have fat. However, if it progresses to NASH, this is the more worrisome, as it is associated with worse outcomes, worse liver outcomes, worse other cardiac outcomes, and progression to cirrhosis and liver cancer. So what is NASH is non-alcoholic steatohepatitis. That means there is fat. Steatosis means there is fat in the liver. There is inflammation and ballooning. That means the fat is causing injury to the liver cells. The liver cells are dying because of the fat. And there is fibrosis. So after the liver cells are dying, they are being replaced by scar tissue. It's similar to whenever we get an injury over a skin. So after the skin heals, there is replacement by scar tissue. Same happens in the liver. So when there is fat, the fat is damaging the liver cells are dying, and it is causing scarring of the liver. So when almost more than 80-90% of the liver is scarred, it leads to cirrhosis. That is late stages of fibrosis. Almost 20 to 25% patients with NASH will progress to cirrhosis. And almost 7% of cirrhosis will lead to liver cancer. And both these stages are associated with increased liver-related mortality, decompensation, and liver transplant, leading cause of liver transplants. So when we come to the population of India, approximately we have 138 crore population. And we extrapolate the percentages, then we can imagine the burden it is going to create in the coming years. Almost we are looking in the next 5 to 10 years, 3 crore patients with NASH-related cirrhosis, 21 lakh patients with hepatitis C-related, NASH-related hepatocellular carcinoma, that is liver cancer. So we need to stop at this stage. If we can prevent the progression of fatty liver to NASH, then all these numbers will be much less. And this is the agenda of the current meeting. This is the agenda why on 8th June every year International NASH Day is celebrated. And Zydus is doing a phenomenal work to spread awareness about this. So it is a multisystem disease. It's not like if you have fatty liver, it will only affect your liver. Fatty liver is associated with increased heart disease, increased kidney disease, increased sleep apnea, that is manifested as increased nighttime snoring, daytime sleepiness, lethargy. There are increased risk of cancers apart from the liver also, like there is increased risk of lung cancer, GI tract cancers, and other cancers in patients with fatty liver. Patients with fatty liver also have high cholesterol, high blood pressure, and polycystic ovaries, which may lead to infertility. And it is both ways. Fatty liver is increasing the risk of those complications, and presence of these complications is also increasing the risk of developing fatty liver. So patients with diabetes, obesity, hypertension, high cholesterol levels, thyroid disorders are prone to develop fatty liver. Apart from these, there are few genetic predisposition. Nowadays we are seeing a lot of patients in whom all the family members have fatty liver disease. Few are coming with cirrhosis, few are in the stage of NASH, few have just simple fatty liver, but almost 4 or 5 members of the family are having fatty liver disease. It is going to be a huge problem in the future. So we need to act fast. And physical inactivity, as I mentioned earlier. So the problem with fatty liver is it is usually asymptomatic. Patients will not have any symptoms until the liver disease has progressed to a stage of cirrhosis or liver cancer. So early detection is the key, but it is often missed because the patients do not report to a healthcare facility. It is usually detected incidentally when an ultrasound is done for any other reason or a liver function test is done for any other reason. However, few patients may experience fatigue. They may have right upper abdomen discomfort or pain because in fatty liver, there is increase in size of the liver. There is stretching of the liver capsule, which may produce some discomfort or pain. But not all patients will have these findings. Once NASH cirrhosis develops, then patients will have findings like ascites, bleeding, jaundice, confusion, or hepatic coma, like I mentioned previously. Now, important is how do we diagnose fatty liver disease? So it is a silent killer because the progression of disease is very gradual. It's not like that one day you have fatty liver, next day you will have cirrhosis. It takes 5 to 10 to 15 years to progress from a stage from fatty liver to cirrhosis. So that is why it is a silent killer. In the stage of fatty liver, initial 5 to 10 years, you will not have any symptoms. Once you develop cirrhosis or liver cancer or decompensation, then you will present to a healthcare facility. So it is important that we do routine blood test or ultrasound at least yearly to pick up fatty liver. It is more important in patients with risk factors and not usually recommended for everybody. So most simple and easy test to do is do a liver function test. It contains the AST and the ALT. And if they are elevated in the presence of a fatty liver on ultrasound, it usually is a indication that we may have a progressive fatty liver disease, that is NASH. However, 80% patients with fatty liver can also have a normal ALT, and it is not mandatory to have an elevated ALT. But if it is raised and it is persistently raised despite treatment, then it is associated with a progression of disease. So because of this shortcomings, various scores have been developed. These are very simple scores. The online calculators are available where we put in the age of the patient, the AST, ALT, and the platelet count, and we get a FIB4 score. Similarly, we have another score, the NAFLD fibrosis score. It is slightly better than the FIB4 score. It was developed specifically for fatty liver disease. And it also has simple parameters like age, AST, ALT, platelet count, the body mass index, which can be calculated by the height and the weight, the fasting glucose levels, and the albumin levels. So these anybody can do, even at the periphery center, a doctor or a nursing staff can do if you have these parameters. Even the patients themselves can calculate these online if they have the report of these parameters. And it will give a fair idea of whether you have a progressive fatty liver or not. Next is the ultrasound. So this is a normal liver on ultrasound. This is the outline capsule of the liver. This is the diaphragm. We can distinctly demarcate the liver. This is fatty liver when the liver becomes bright on ultrasound. It is more white than this. And this is a cirrhotic liver. It is shrunken, it is nodular, it is cirrhotic. Ultrasound is very easily available, it is economic, and diagnosis of fatty liver can be made fairly easily on an ultrasound. However, the shortcomings are that it only detects fatty liver when the amount of fat is more than 25%. So fatty liver is when the fat is more than 5%. So we will miss patients with 5 to 25% of fat if we only do an ultrasound. So we need more tests to do. And ultrasound can also not differentiate from a fatty liver from liver scarring. So then we have a Fibroscan or a transient elastography. So the principle is transient elastography. We place this is the probe which we place. It's similar to an ultrasound probe which sends vibration to the liver. And the speed with which the vibrations are traveling in the liver are measured. So if the liver is hard, the vibrations will travel more fast. If the liver is soft, the vibrations will, the speed of travel will be slow. And when we do this test, we get two values. One is the liver stiffness measurement, which tells the degree of hardness or fibrosis of the liver. The other is the CAP, controlled attenuation parameter. It tells the amount of fat in the liver. So when we do a Fibroscan, we get two values. 5.2 is the LSM and 198 is the CAP. So 5.2 is normal. Anything above 8 should be considered, which should be shown to a gastroenterologist or a liver specialist. And 198 is also normal. Anything above 220 denotes fatty liver. So the Fibroscan can detect fatty liver if the fat content is more than 10%. And as we have two different values for fat and fibrosis, it is a very good test in differentiating between fat and scarring of the liver. And it is easy to operate. It can be done by a technician. However, in very obese patients with BMI more than 35, it is not reliable. The next we have an MRI. So MRI is very good. It is a gold standard non-invasive test to detect liver fat. The benefit of MRI is that in this, the whole liver is analyzed and the average fat of the liver is quantified. In Fibroscan, we sample only a short area of the liver. So if there is some areas of the liver have a higher fat, some have a lower fat, then it may not be reliable. But problem with MRI is that it is an advanced software, it is an advanced machine, and it's not available everywhere. We may also have to do a liver biopsy in few patients with fatty liver disease. But nowadays, with the improvement of non-invasive technologies like Fibroscan and MRI, most of the time we don't require a liver biopsy. However, patients who have suspicion of another underlying liver disease like autoimmune hepatitis, Wilson's disease, then we do a liver biopsy to differentiate the two, whether the liver injury is being happening due to fatty liver or it is a consequence of other liver disease. So it is a simple test. It is done under ultrasound guidance. We put a small needle into the liver and take a sample from the liver. And I want to highlight that if a gastroenterologist is advising a biopsy, it doesn't mean that you have cancer, and that's why we are doing a biopsy. Biopsy is mostly also done for non-cancerous indications also, like we are doing for fatty liver disease. And the risk of spread of the disease or becoming cancer is not there with getting a liver biopsy. So now we have talked about how we can diagnose fatty liver, what is the burden of fatty liver, how important it is to prevent and treat fatty liver disease, and what are the consequences if the fatty liver progresses to an advanced end-stage disease like NASH or NASH cirrhosis. So we don't have to do very hi-fi things to prevent fatty liver. Just we have to go back to our basics, go back a few generations and follow what our previous generations used to do. Maintain an ideal body weight, exercise daily, eat healthy diet, don't take too much sugars, don't take too much fat, don't take alcohol, or take within the safe limits. So alcohol is very important. One should know how much alcohol is safe. So if a patient who has underlying liver disease or underlying fatty liver disease, no amount of alcohol is safe for the liver. So if you are diagnosed with a fatty liver disease, then you should totally avoid alcohol. However, patients with a normal liver, normal LFT, they can have, men can have 2 drinks a week, 2 drinks a day, and women can have 1 drink a day. So 1 drink is approximately 30 ml whiskey, but not more than that. You exercise regularly to maintain an ideal body weight. The ideal body weight is roughly 100 minus the height in centimeters. So if somebody's height is 170 centimeter, his ideal body weight will be 70 kgs. So the target should be to keep a body weight at the ideal body weight level. However, if you're not able to achieve that, any amount of exercise will help in preventing fatty liver and improving it if it is there. And since fatty liver is a silent disease, annual health screening, which should include an LFT and an ultrasound, may be done for early detection, but this is not required for all patients, especially in patients who are elderly, have diabetes, hypertension, they are obese, or have some underlying other comorbidity. So they should get an annual health screening for detection of fatty liver disease. Following a healthy diet is very important. As I said, alcohol is not good for the liver. Aerated drinks like sodas, colas, bakery items which have a lot of preservatives, sodium bicarbonates, breads, biscuits, the fried products like French fries, burgers, pizzas, these are all bad for the liver. They increase the burden of fatty liver disease, increase the risk of developing fatty liver disease. Green vegetables, leafy green vegetables, cauliflowers, beetroots, fruits, especially the citrus fruits, high protein diet like eggs, fish, walnuts. Walnuts are very good for patients with liver disease. Even for patients with advanced cirrhosis, walnuts are very good. They have branched in amino acids, which are helpful in improving the muscle loss seen in patients with liver disease. Garlic, coffee. Coffee, I'll mention especially here. Sorry, coffee. At least drinking 2 cups of coffee has been shown to improve fatty liver disease. Apart from diet, exercise, I have told lifestyle modifications like avoiding alcohol, smoking, avoiding too much oily foods. And there are some medications, few which have been approved in India, like saroglitazar, vitamin E, pioglitazone. These are all approved medications for fatty liver disease. But there is a specific subgroup of patients who will benefit from these medications. We cannot give them all these medicines to all the patients with fatty liver disease. Only a patients with NASH are eligible for treatment with these medications. So it is necessary that you speak to your doctors about the available treatment options. So coming to diet, the goal should be that you should take a low calorie diet. That is, decrease the caloric intake by 500 kilocalories per day. So average Indian male takes around 2200 to 2300 kilocalories in a day. So if you have a fatty liver disease, you should take around 1700 to 1800 kilocalories per day. Balanced Indian diet is good with the mix of vegetables, legumes, pulses, rice, chapatis. High protein diet is recommended. We should avoid refrying oil. Like there is a tendency in Indian homes to again and again use the same cooking oil and frying things again and again in that. So that should be avoided. That increases the amount of saturated fatty acids, and it is very harmful for the liver. And cut sugars from your diet as far as possible. So this is a sample which should be followed for a patient with fatty liver disease. In daily, you can consume milk, cheese, yogurt, can be taken olive oil, fruits and nuts, and pulses, potatoes, rice, legumes, vegetables, quinoa, oats. These can form the basis of your main ingredient of your meal. And supplement with fruits, nuts, use olive oil for cooking, and supplement with milk or yogurt. Then weekly you can have, if you have non-veg, then you can have chicken, eggs, fish, and seafood. Sweets, not more than 1 or 2 servings a week. That is very rare. And red meat should be avoided. Around 1 to 4 servings in a month, not more than that. So coffee, as I was talking about, 2 cups of coffee a day, and this is black coffee. It is without milk and without sugar. So it's not like that you are adding 2 teaspoons of sugar in your coffee and then having 2 cups of coffee. That will increase your risk of fatty liver disease. So it should be black coffee without milk, without sugar. It will taste bitter at first, but once you start making it a habit, start having it daily, you'll really like the taste of it. And I think you will not like coffee which has added sugar in it, because it masks the natural taste of coffee. So it also decreases fatty liver, and it decreases the progression of liver disease, along with decreasing the risk of liver cancer. So exercising, when coming to exercise, so what question most of the people have, that what exercise should I do? Should I run? Should I do cycling? Should I go to swimming? Should I do weightlifting? So as of now, both of these are equally effective in improving fatty liver disease. None of them is superior to the other. Ideal would be a mix of both, because aerobic exercise will reduce the liver fat. It will help in maintaining a healthy weight, and it will improve the improve your heart function. And going to a gym, doing resistance exercises like weight training, they will improve liver injury, that is inflammation, they will improve insulin resistance, and they will improve the other metabolic parameters. So mix of both is advisable, but if you are unable to do it because of multiple reasons, most of the patients who are obese, they have fatty liver, they also have associated arthritis, they are unable to walk for long distances. So we advise them to do resistance exercises. They can easily start with weight training at home also. They can do slowly build up their resistance exercises. They can start with 1 or 2 kg weights and then gradually increase. At least target should be to walk, to exercise for 150 minutes a week. That is 30 minutes a day, not more, and for 5 days. So even this much, if you can give for your body, it will be sufficient. Now most of the everybody has a smartphone or a fitness tracker which they wear in a wrist, so you can keep a track of your steps and aim for a target of more than 10,000 steps in a day. And you should take small breaks while sitting for prolonged periods. It is very important for people who are sitting on the desk working on computers for long working hours. At least every hour you should get up for 2-3 minutes, take a small walk in the office or at home, uh, get climb 1 or 2 flight of stairs if possible, and then go back and keep on doing your work. So this will improve in overall, improve your health and improve fatty liver. So weight loss is the only strategy right now which is available, which has shown to improve scarring of the liver, that is fibrosis. No other medicine, no other drug, no other intervention diet has shown to improve fibrosis. There is improvement in fat and inflammation with the medicines and the diet, but the fibrosis, which is the end stage, is not there with any other medicine. Only weight loss can achieve that. So a target weight loss of more than 10% should be there. So if patient is weighing 80 kg, we advise them you should aim for to lose 8 kgs weight in the next 6 months. So if they are able to lose that 8 kg weight, then there is significant improvement in fibrosis. However, if they are not able to lose 8 kg, they lose 4 kg, 5 kg. So any amount of weight loss is beneficial. So if 3% weight loss is there, there is improvement in fat. If 5 to 7% weight loss is there, then there is improvement in the inflammation with the liver injury which is occurring. But ideal is 10%. You should aim for the highest and achieve whatever you can. So in the end, I would like to say that only you can change your life. No one can do it for you. So have a healthy lifestyle, be healthy, have a healthy diet, maintain an ideal body weight, exercise regularly, and you'll be free from fatty liver. Thank you.
Thank you, sir, for this wonderful talk. I think this has enlightened all of us. And now we'll take questions from our audiences with your permission, sir.
Yeah, sure.
Sir, how long the medicine for fatty liver will continue?
Right now, recently Indian guidelines have been published. So at least for 1 to 2 years, the medicines are to be recommended if the patients have non-alcoholic steatohepatitis, that is NASH. For simple steatosis, we don't usually give specific drugs to treat that. But if the patient has NASH, then medicine should be continued for at least 1 to 2 years. And then we can reassess the improvement in liver function test, improvement in Fibroscan at least 6 months to 1 year.
Sir, any tips for weight reduction sustenance? I am losing weight but unable to sustain.
So there are no shortcuts to that, I think. The best is that you have to maintain a diet and exercise. If you stop either of the two, then you will have a tendency to gain weight again. So what is the key is that you have to, your energy expenditure should be more than what you are eating. So if you are following a hypocaloric diet, but you are not spending that much energy in your daily routine, then you'll gain weight. So if you are taking 1700 kilocalories, but you are not working up to that amount, then you will start gaining weight. So key is that keep a track of your daily intake. There are a lot of mobile phone apps, online calculators available where you can key in your daily meals, and then it will give you the total calories which you have taken in a day. And then you can exercise, keep your schedule that always your exercise is more than what you are consuming. So that will help in keeping a steady weight.
So the next question is related to alcohol. Once weekly alcohol is safe to consume if I am having fatty liver.
As I said, in patients with fatty liver disease, no amount of alcohol is safe. And it also depends on the amount of alcohol you are taking for the time duration, like how many years you are taking alcohol. In patients with fatty liver disease, no amount of alcohol is safe. For normal patients, 2 drinks a day, that will amount to around 14 drinks in a week is for males, and 1 drink a day for females, and that is 7 drinks a week for females. But that is with patients who have normal liver, not with fatty liver disease. So if patients with fatty liver disease are consuming alcohol, even 1 drink or 2 drinks a week can be harmful. They may not immediately progress to cirrhosis in the early stages, but when taken for a prolonged period, they will have early development of cirrhosis. They can have worsening of liver disease, like they can develop jaundice due to alcoholic hepatitis. So that should be avoided, especially binge drinking. Binge drinking is when you take 4 or 5 drinks, more than that within 2 hours. So that is very harmful pattern of drinking, and that should be totally avoided.
Yes, sir. So on behalf of NASH 24/7, I thank Dr. Rohit for this lively and informative talk. As sir, you have been emphasizing the awareness for liver health and disease. It is also important for people affected by fatty liver to regularly visit the doctor and continue
Yes.
the medications, diet, and exercise. With careful observation of precautions, it is possible to obtain the control of this disease. And I would like to thank our audience for their active participation and patience in making this event successful. You may also share your suggestions so we can address them in our upcoming FB Live programs. Till time, stay connected with NASH 24/7 on Facebook and YouTube. Take care of yourself and your family members. Thank you once again to you, sir, and good night all. Thank you.
Thank you. Thank you all.